Hi, it's Dr. Mike. In this video, we'll be discussing the fibromyalgia criteria relating to the diagnosis of the condition. And at the end, I'll also tell you how a lot of the times the final diagnosis is made. So yeah, I hope you enjoy it. So first off, please note that this presentation is not intended to provide individual patient advice, but rather it's a way of providing education about fibromyalgia. And if you think you have a condition that is causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment plan. So when we look at the diagnostic criteria of fibromyalgia, there are four main symptoms: pain, fatigue, waking unrefreshed, and cognitive symptoms. And what you need to also understand is that as we learn more about the condition, the diagnostic criteria do change. The way that it used to be diagnosed when it was first discovered back in 1990 versus the way it is now is changing, and that is usually a dynamic process as basically more research and more information comes to the fore. And then also you have different specialists who have different opinions on it and different views, and your diagnosis often depends on who you're consulting, which country you're in, and what the setting is. So you need to be aware that what I'm sharing with you are my opinions, and also combined with some of the science that's out there, but whoever you're speaking to might have a different idea or focus. Generally, the best medical specialist for diagnosing this is a rheumatologist. They specialize at looking at joint and musculoskeletal disorders, and so ultimately, if that is what you want to figure out, that would probably be the best place to go. So when we look at the criteria, the first criteria we look at is the widespread pain index, which basically pertains to pain. And this is musculoskeletal pain when firm pressure is applied to specific areas, which we call tender points. So you see these little red spots on the diagram here. These are tender points that typically are painful. When you have fibromyalgia, the pain can be mild to severe. There are 19 points here, and yeah, depending on which criteria you're using, the older criteria looked at these points, and if you had more than 11 of the 19 points painful or tender, then they would consider it a positive for the diagnosis. The new diagnostic criteria look at more at some of the other symptoms associated and kind of look at a more combined overall way of diagnosing. So commonly these points are on both sides or bilateral, and it can also be, and usually is the upper and the lower body. So basically pain kind of all over and tender points all over the body. So you get a score if you add up how many points are tender. You get a score called a widespread pain index score, and that's out of a possible 19. With some of the newer criteria, you need at least 3. And the next thing they combine is the symptom severity scale, where you look at a combination of the other symptoms. So if you remember, fatigue was one of the other symptoms, which is often different from the regular tiredness. It could be described as a physical exhaustion, a lack of energy or motivation, and fatigue that doesn't go away after rest or sleep. And it can be considered, really mild to really debilitating. This is also where chronic fatigue syndrome and fibromyalgia have a lot of overlap, and a lot of the times, you could be diagnosed with both because the criteria are so similar. When we say waking up unrefreshed, you could wake up tired and stiff. You could have constantly interrupted sleep or disordered sleep, and that's typical of fibromyalgia. So this is the symptom severity scale here on the right. And then you see all your symptoms: fatigue, waking unrefreshed, cognitive symptoms, and the somatic symptoms refer to the body aches and the body pains. And then those will basically be rated. Basically, when you look at the cognitive symptoms, then you would also be looking at things like lack of concentration, depression, anxiety, lack of motivation, the fibro fog, which is kind of this fuzziness that you have, temporary memory impairments, word mix-ups, clumsiness, dizziness. And these are all, three of them, all four symptoms are rated according to the criteria. So if you don't have any problems, you rate it as a 0. If it's mild, it's a 1. If it's moderate, it's a 2. And if it's severe, it's a 3. So each one of these criteria, you will then be rated. And basically then they add up the ratings and to give you a score out of 12 for the symptom severity scale. And usually you need 5 or more. And this is then combined with pain index score. And then you're looking at a combined score of above 13. So 13 or more out of 31 usually means that you will be diagnosed with fibromyalgia. But there are some other factors involved. So basically, yeah, when you look at the scores, some diagnoses are going to have a higher pain score, and the other symptoms are not going to be as highly rated, or sometimes you can have a really low pain score but a much higher symptom severity score. Both of those combinations are possible. The main thing is you need that combined score above 13 out of 31. Then chronicity is a big factor too. So you have to have had symptoms at a similar level for at least 3 months before you get diagnosed with the condition. And then the other factor is the causative disorders or other disorders. Now, when they say causative disorders, they mean that your symptoms of fibromyalgia could be caused by something else, and they need to basically test to rule out those other disorders. So examples are hypothyroidism, which is a thyroid condition. When your thyroid hormones are low, it can lead to the same kind of tiredness, fogginess, and pain. That will obviously be tested or be picked up when they test your thyroid hormones. Then polymyalgia rheumatica is another condition that looks a lot like fibromyalgia, as well as certain autoimmune conditions such as rheumatoid arthritis and lupus. So a lot of these have got specific tests you do which confirms whether you have these or not. Chronic infections like Lyme will also come up on tests. Sleep apnea is a kind of condition where you keep waking up because you can't breathe properly when you sleep, and then that prevents deep sleep and can also lead to all the tiredness and pain and stiffness after it's been going on for a long time. And then stress-related conditions like post-traumatic stress syndrome, or huge emotional stress, or psychological stress, or upset, can lead to high levels of stress hormones, and eventually problems with how these things work, which can also then lead to a lot of the fibromyalgia symptoms. And then lastly, all of these other conditions need to kind of be ruled out before they diagnose it as fibromyalgia, because it's a diagnosis or exclusion. So these are some of the factors that your therapist or doctor will be looking at before they make the diagnosis, but each person is going to have a slightly different way of looking at it and putting it together. And they're going to be, more or less interested or focused on the conditions. So depending on which specialist you get, you might be diagnosed with one condition and not another. And, it's a little bit of a gray area, but essentially that sums up the main criteria that they will use when they make the diagnosis. I hope that's answered some questions. I have another video in the series titled Is Fibromyalgia Hereditary, where we go into the genetics and the underlying hereditary factors. You're welcome to stay tuned for that. And then I have put together a little 10-part fibromyalgia mini course. There should be a link in the description or in the comment section. So yeah, feel free to comment, give me a thumbs up if you liked it, or subscribe to the channel. And then I hope to see you on the next video.